Monique Henry has fond memories of her daughter's birth.
I was fortunate enough at the time to be able to have a birthing experience at the Gladstone Hospital. It was all very straightforward. Knowing that I'm not going to have that this time is really scary.
Now 38 weeks pregnant with her second child, she's facing a very different scenario. Gladstone's private Mater Hospital has since closed, and 6 months ago the town's only public hospital suspended its birthing services due to staff shortages. Most expectant mums are being referred to Rockhampton, more than an hour's drive away.
Now Rockhampton is servicing all of Gladstone, all of Billawheeler. There are other hospitals that are impacted by maternity shortages.
Monique has chosen to drive 2 hours south to Bundaberg to give birth.
I can't say that I'm going to travel to Bundaberg 2 days before my due date so I can just hang out there, because we don't have family there. We're going to just have to wing it. When I am in the moment of enjoying the fact that I am pregnant and that I will soon have a son in my family, it's overshadowed by stress of what happens if I give birth on the side of the road? What happens if I have a medical emergency and I start hemorrhaging? It's terrifying. Ooh, it is, it's scary.
Gladstone is a major industrial hub in central Queensland. Its hospital usually delivers around 600 babies each year.
We're a thriving, growing community of 60,000 and growing. It's outrageous that we can't birth here.
Gemma Manwaring is a local mother turned advocate. Her Facebook page pushing for the reopening of Gladstone's maternity ward has become a magnet for mums wanting to share their stories.
We had a story on the Facebook page last week where a mum in labour was transferred with another mother who had miscarried. And so they were both sharing an ambulance together. There's other stories where mothers are describing the hospital as just being completely packed, and they're labouring in the shared showers of a ward.
The Central Queensland Hospital and Health Service says patients would only share an ambulance as a last resort, and women in established labour are given individual birth suites. They say unexpected staff absences and a nationwide shortage of obstetricians have caused the prolonged closure. And while elective C-sections and emergency birthing services have been reinstated, there is no timeline on when local women can once again plan to have their babies in Gladstone.
To suddenly not have enough doctors to go around doesn't just happen overnight. Surely there's recruitment employees who can look into this and should have been looking into things 2 or 3 years ago to make sure that we can adequately plan, deliver and evaluate the services that are being offered.
Dr John Hall is a rural GP obstetrician and past president of the Rural Doctors Association.
It is a canary in the coal mine. It is a warning sign that other similar size units might be under stress or be at risk of closure.
Between 1996 and 2017, more than 40 birthing services were closed in Queensland. In 2019, a task force investigating the closures found the rate of babies being born before they arrived at hospital had more than doubled in 20 years. It called for rural maternity services to be brought closer to home to improve outcomes for mothers and babies. But since then, more have been suspended, and there are fears that others could follow.
There was some good effort put into reopening services in Queensland, but what we're not seeing is the sustained effort and investment that's required to make them viable in the long term.
I thought, well, we'll just get in the car and hoof it, and hopefully, we'll be okay and we'll get there and we'll have that beautiful birthing suite. We got 20 minutes down the road and it was getting very, very intense. At the same moment my waters broke, I felt my child's scalp between my legs, and I said to my husband, look, we've got to pull over right now. We're there on the highway next to a big field of sorghum, I think it was, and my baby, she's been born.
Yvette Bracefield made headlines when she welcomed her daughter Beatrix on the side of the Warrego Highway outside Chinchilla last year. She says the experience shook her faith in the local health system and was a major factor in her family's decision to move to Melbourne, at least temporarily.
And I think we were maybe there for 6 weeks to 2 months, and we thought this is a huge, huge mistake. I did feel angry when I thought back about, the day of Beatrix's birth. I felt upset that the trauma with the way that day went was a trigger point that led to what I felt was a huge mistake for our family.
Chinchilla, 4 hours west of Brisbane, is home to 7,000 people. Since 2013, local birthing services have fluctuated due to staff shortages. Accompanied by a midwife, most women make the 1-hour drive to Dalby to have their babies. Darling Downs Health has released a plan to reinstate local birthing services, but there's no timeline on when.
When we lose birthing, we lose the operating theatre, we lose the highly trained critical care staff that often work in operating theatres.
Dr Hall has spent much of his career working in rural Queensland, but he says there are barriers that make it unattractive for doctors to work in the country.
Too much on call, having to back up night after night being called in, too much difficult shift work. So what we need to do with recruiting, it's not okay to just recruit one extra doctor or one extra midwife. They need to be recruiting en masse.
He says the health system should provide better pay and support for doctors in rural areas and reduce red tape to get them there in the first place.
They actually don't have the right incentives in place to make these jobs attractive, to pull people out of well-paid city jobs. When you look at the mining industry, they do this extremely well.
Queensland Health Minister Yvette D'Arth declined to be interviewed by 7:30. In a statement, she said workforce shortages were a national issue and Queensland Health was aggressively recruiting to fill gaps in maternity services.
As a state, there's a lot of money going into infrastructure for the Olympics, for example. If birthing was an Olympic sport, would we get more attention? Because clearly giving birth by the side of the road isn't enough.